Hi, we are coming to you from the Roar Room at Penn State, and we are here today to talk to you about pathways to healthcare at Penn State. My name is Marc Dingman. I am a teaching professor in biobehavioral health and the professor in charge of the undergraduate program in biobehavioral health in the College of Health and Human Development.
And I'm Bob Paulson. I'm a professor in veterinary and biomedical sciences. I'm also the coordinator for the immunology and infectious disease major in the College of Agriculture.
And my name is Lisa Gatzke-Kopp. I am a professor and the department head for Human Development and Family Studies, which is also in the College of Health and Human Development, along with Marc.
All right, so I guess when I think about healthcare, I think of it as an infrastructure. It really is a mass of organizations and systems that are designed to help promote health and well-being, and whether that involves treating illness or just promoting, positive health states in people that are already healthy. I think that it's something that anybody should care about, including current college students, because it's something that will affect their lives for the rest of their lives, and it's affecting them now, and it affects the lives of people that they care for as well. So I think it's something that really everybody should have in their mind in some way.
Yeah, absolutely. I think that it is a lot of different things, like you talked about, and having, we typically think of like doctors and nurses as healthcare providers, or thinking about when something goes wrong, how do we get treatment for it? And that can include a lot of other things like physical therapists or occupational therapists, speech language pathologists, people who are helping improve the well-being of somebody in any number of specialized areas. It doesn't have to be just general medical kind of wellness, but I think we're also, as a society, really focusing on not just fixing disease states, but prevention and optimizing wellness and well-being as well for people. So that can be done at more of a policy level. That can be thinking about how our community is promoting wellness for people. And there's just a lot of opportunities and ways for students to find career paths that intersect in this domain.
And maybe I could just add a little bit more to that in thinking about also another side of healthcare is trying to understand the causes of disease, trying to understand, basic biology, and think about how can we develop therapies and treatments that'll help, ease disease and suffering and prevent disease in the future. And so I think these are the kinds of things that students really need to think about, how that's going to impact their lives now and how it's going to impact the lives of their families when they're older.
Yeah, that's a great point. Sort of that basic science and discovery and innovation around treatment and understanding when a new virus comes out. What is it? How do we fight it? And then that is something that is kind of in that basic science side. And then there's the supplied delivery side, and there's that full spectrum that, you can get access to at Penn State.
Mm-hmm. And I think so often students and probably their parents too think of healthcare and they think of just the treatment of disease. But like you mentioned, I think that's a really growing emphasis on the importance of just promoting healthy states and people that are already healthy. And so I think that's going to, over the years, become more and more a part of healthcare for current generations.
And I think that there are a few areas that people might not think of in healthcare is also, in the College of Agriculture where I am, there's a lot of emphasis on One Health, which is health in animals and health in people as well, and how different practices on the farm, say, or through handling of food, how that impacts the human health as well. And I think having a much larger view of how this works it only makes it more exciting for students coming in and more exciting for us as professors.
Yeah, everything is connected in a way. And I mean, that gets the idea of the impact that students can have with some sort of degree in healthcare is really wide-ranging because, as we've been talking about, healthcare careers involve much more than just treatment. So, you can get a degree, healthcare-related degree, and go on to do something like become a doctor or become a physician assistant, and you're directly involved in treating patients. But A lot of our students are looking at all these other tangential aspects of healthcare as well. And really that impact on society can come in multiple ways beyond just treating patients now.
Yeah, so in the college that Marc and I come from, I would say pretty much every degree has intersections with health and wellness, and that's why we are called health and human development. But, thinking about nutritional sciences and understanding, the farming aspects and the agriculture, how do we get food and what is the food that we need and how are we preparing, families or schools to provide nutritional resources. It can be on any kind of level. We have kinesiology, is really that kind of physical wellness that can range from an orthopedic kind of career in medicine to physical therapy or occupational therapy or other things. In HDFS, we're really very focused on whole person kind of lifespan development and thinking about what are the contexts that people are developing in. And that's everything from, how are families prepared to take care of children and provide healthcare and wellness developmental opportunities for them, all the way to what is the neighborhood like? How are we affected by our geography and our climate, and how is that affecting health and wellness? And so we really have a degree program that's scaffolded for students who are wanting to go into more direct service delivery, all the way through more policy or advocacy types of routes to address these things.
Yeah, and I think, on our side, we've kind of focused a little bit more on, providing opportunities for students to participate in research projects. We have in our department, we have immunology and infectious disease major. We have a pharmacology and toxicology major as well. And these majors are much more basic science kinds of things, but they're kind of delineated from what you would think of as more like biology and biochemistry, which are, again, even more basic. And I think what students who come to our majors get is this focus on learning a foundational science, but also being able to focus on real world problems,
Mm-hmm.
real world types of diseases that they're encountering right now. And I think, with the past COVID pandemic, we see an uptick in students really interested in how vaccines work, how diseases move through populations and things like that. And I think we're able to, plug students into those types of topics quite nicely and give them opportunities to do, real research, right?
Mm-hmm.
And contribute.
Yeah. Were you going to say something?
I was just going to say that, in biobehavioral health, which is my department, 30 years ago, it was a revolutionary idea. So biobehavioral health focuses on the many different factors, like you were alluding to, that influence health. So really beyond biology and just behavior, but biology and behavior and environment and culture and society. And 30 years ago, that was a really novel idea to be looking at health in that way. But I think it's clear from what both of you are talking about that it's become kind of the norm to be looking at all these different factors that are involved in health and can influence health in many, many different ways.
Yeah, I think there has been a shift as well in terms of, preparation for something like medical school used to be very much these basic science. Like you have to know your biology, you have to know your chemistry, or you're not going to pass the MCATs. And I think all of us now have programs that allow for those basic science requirements to be met along the way so that there is that preparation. But then there is much more of an emphasis on things that I think medical schools are really looking for now, is that ability to connect to other people. Do you have these sort of other skills beyond just the science? Because a doctor is not going to be effective if they can't communicate with their patient, if they can't understand the context of what is this patient's life context like, and if I make this recommendation for treatment, are they really going to be able to follow through on that? And do I need to take that into consideration and integrate other kinds of services in how I approach this sort of treatment? And I know we have, I think it might be even out of BBH, the global health minor.
No, it's still BBH.
This sort of, this idea for students to add on to these majors. There's so many minors that are available throughout Penn State that really help give some sort of flavor or spin, because you might also be interested in healthcare in, third world countries or other kinds of geopolitical events that are affecting wellness and solving problems of how do we provide treatment when there's a war going on, or how do we engage in these kinds of things. So there's almost an endless possibility at a place as big as Penn State to find what version of health and wellness you want to really focus on, and then the full range of ways you can focus on it.
Yeah, the global health minor is it's still out of BVH, and it's just a good example of what we're talking about. We have a lot of students who may not have any interest in global health, and then they start learning more about the minor, and they eventually decide to take part in it. And then they realize that the health issues that we look at in the United States are just completely different than what people are dealing with in other places throughout the world. And the minor involves a 6-week fieldwork experience where they're going to sites, other places like Tanzania, South Africa, and working with populations there in things like health education and sometimes assisting medical teams there. And it's just transformative for them to be on the ground, seeing this, firsthand, and seeing the difficulties that people are having, that things that we don't really have to think about very often in certain developed countries, but just kind of underscores what we're talking about, how health has become a global issue, something that you have to take into consideration a lot of different factors to understand it.
Yeah, so I meet with a lot of parents and prospective students who are interested in immunology and infectious disease, and one of the things I always bring up is the global health minor, because it's an opportunity for you to see healthcare in other countries and be a part of it. And I have to admit, we kind of used your model in building our One Health minor. So One Health is, again, this idea that animals on the farm and humans their health is intimately connected, and so we have a minor that follows that and teaches students about how antibiotic resistance on the farm is going to have a huge impact on human health, just as a general example. I think another thing that comes up with healthcare, and I think that is important here at Penn State, is teaching students to be good consumers of science and healthcare,
yes,
right? And it's something in my own class that I teach immunology, and we talk a lot about, the rhetoric that's out there now and what's going on about understanding, when people talk about a study being good or bad and things like that, what does that really mean? And what are the words that people are using? Are they biasing you with those words and things like that? And that's something I think if students can come out of here being good consumers of science and understanding, having a basic understanding, they're just going to be better consumers of healthcare and wellness when they become adults as well.
Absolutely.
Mm-hmm.
Yeah, I just got done teaching epidemiology and introduction to biobehavioral health, and in both of those classes, I spend a decent amount of time talking about exactly that. And I mean, we cover study designs and the designs that are underlying headlines in the news, and can this study really actually tell us that something causes something else, or is it not able to do that? And it's kind of eye-opening for students to realize that I'm seeing these headlines that suggest A causes B, but really this is the type of study that can't allow you to determine that. And so I completely agree with what you're saying.
Absolutely.
Mm-hmm.
So in terms of careers, where are students in your majors usually ending up?
So in students who kind of come out of our main basic science majors like immunology and infectious disease and then pharm tox, they kind of go on a couple tracks. Most of our students are pre-professional students, right? So they're looking to go to med school or PA school or something like that. We have really good track records there. And I should just, for the purpose of the podcast, I think you should give a shout out to the College of Science and their pre-professional advising group. They're excellent.
Mm-hmm.
They really do a good job. So a lot of our students go that route. We have, in the recent years, we've had a lot more MPH students wanting to go do MPH. And right now we're working with the med school at Hershey to get a 5-year IID MPH program set up. And the rest, tend to go to graduate school to do PhDs. And I think what we've been able to do and been pretty successful with is giving students opportunities to work in laboratories. Because if you're going to go off to do research, you really have to have done it at some point.
Mm-hmm.
And, I sit on admissions panels for graduate programs here at Penn State. And, that's something we look at right away is do the applicants have research experience? And I think we're doing a good job with that. And then there's a small percentage of students that go into biotech or pharma, either working as research technicians and research support, or they go into marketing and sales because they're able to understand, explain drugs and things like that. So that's where most of our students go. And we've been pretty successful in placing students along one of those tracks. Yeah.
Yeah. So in HDFS, we have a wide range of student interests. And so we really think about it in its sort of three prongs or three dimensions that they are well positioned to go in. And one of them is sort of in a counseling track and really focusing on mental health and providing mental health both, across the lifespan, child, adult, kind of geriatric issues and those kinds of things. So we do have a large number of students that go on into these types of professional graduate programs at the master's level and have been really working to create some of these integrated master's programs with the 5-year kind of program. We did just start a master's program through World Campus in social work, and we have a lot of students who are kind of going along in that pre-development pathway. We also have a developmental science for the health professions track as well. So this is where the students who really want to go on into med school, be a PA, have all of their science requirements integrated into their degree, but also then kind of having this sort of understanding of lifespan development and, family context and some of the other things that affect wellness and affect access to treatment and success of treatment. And then we have that kind of third degree where one of the strengths in HDFS really is our, prevention-focused research. And so looking at understanding if we know what the risk factors are for certain negative outcomes, how do we get in earlier and provide services that really divert that kind of more negative outcome, and how do we evaluate those? And so there's a lot of public service, public health provisions, and thinking about how would you support those programs at a different level than being the service provider, maybe being kind of the community director that decides what prevention programs come into the community. How do you evaluate the effectiveness of these programs? And we have different study abroad types of programs too that help think about what does that look like in other countries, as you were saying. So we have one where they go to Cambodia and understand how do non-governmental organizations come into countries like this and provide resources, and how do you marshal limited resources to help the most people the most effective way. And so we really have kind of these different levels at which you can think about accessing the promotion of health.
And do students you mentioned research, do students work in research labs or?
Yeah, so, one of the things that we really kind of promote. So in the Pharm Tox major, it's part of the requirements. In immunology and infectious disease, it's highly advised to work in a lab. And I think what happens with students, and I can probably talk best about my own experience. So I've had a lot of students over the years, almost 90 students have worked in my lab. And they kind of range from the group that, want a letter for med school. And, they come, they work. I write a letter, it's all good, right? And then there's also a small group, I'd say probably about 15%, who really like it. And I think what we're providing there is we're giving them a place where they can find their people, so to speak, right? Like I could go in the office right now and there'd be 2 or 3 of the students who work in my lab just sitting around doing their homework because they like to hang out. And those people are the ones that if I come in on a Saturday, they're working with the graduate student because they like it, Mm-hmm. And I think that really, that opportunity is for a lot of students, even if they don't end up going into research, has given them like a feeling for, as a Penn State student of having like a small family group that they can work with. And, when I talk to parents, like I said, Penn State is a huge place, right? But it's these little things, like things that you guys do as well, that make it smaller and make it, more personal for that student. And I think that's what we do in the research groups.
Yeah, I think there's all of these opportunities to find exactly what version of it works for you or the student to promote their pathway that they want to find. And so the main problem at Penn State is finding it, because I think even with us talking, there's so much overlap. There's so much interdisciplinarity at Penn State that you could do similar things. Like we also have a pathway to a master's in public health, but maybe the student who's coming through HDFS wants to do it from a different angle than the student who's coming at it from immunology, right? So it's everywhere, but you kind of have to find what's the right path for you. And so I think really taking advantage of your advisors, your academic advisors, to help orient you to what is available, but also the departments are doing everything they can to get opportunities in front of students. And so coming to those career fairs, those resource fairs, and really learning about what those pathways are is going to be important in being able to fully take advantage of what is available here at Penn State.
And I'm sure you guys have clubs. I mean, we have a couple of clubs in our department.
Yeah.
And, I've talked to the students, and, we have a biomedical sciences club, right? And, they just drag their friends in because they say, this is a nice group of people to come hang out with and things like that. So I think that that's really helpful to expand the awareness of what's out there.
Yeah, and I can speak as a parent of 2 Penn State students that they both did that, find clubs in their departments that were in that kind of disciplinary focus where they could meet other students who were studying the same things, and they really enjoyed that.
Yeah, there's so many different clubs at Penn State, and I mean, that's one of the things. That it's such a large university. There's so many opportunities, and sometimes that's a little overwhelming. But students eventually, if they keep looking, they'll find something that they, like you mentioned, that they click with. Like we have a BBH society, and we just started a new major last year called the Systems Neuroscience major, and there's a club associated with that, Nittany Neuroscience Club, and the BBH society has a research night. So like one of the issues that one of the questions I get frequently from students is, how do I find a research lab to work in? Right. And so they've organized a night where students can go, and different faculty from our department who run labs are there and connecting with students, and it's a networking event. But like you said, there's so many opportunities for research. It's just a matter, I kind of tell students they just have to sit down with the faculty webpage and start reaching out to people and say, your research sounds interesting. Are you accepting volunteers? How can I get involved? Things like that.
Yeah, and when I get those types of emails from students, if there are positions, if I don't have positions available in my lab, I'm always happy to give, like, here are some people I know in psychology who do similar things. Like, you might not have been looking there because you're an HHD student, but I can tell you, hey, check out this person's research or that, and try to even give guidance. So even if it doesn't work out, making those connections with faculty, I think we're all eager to help. I've had students send me emails and say, I'm looking for a job and I don't have anything to offer, but the next 6 weeks, whenever I got something through my email that was like hiring at that entry level, I would forward it to that student who was not in my major, right? So we're really trying to do whatever we can. I think any opportunity, like getting involved in research or these clubs where you get a better chance to interact with faculty more individually, that there's just a lot of resources available.
And I think that students find that interaction, working in a laboratory situation or something like that, is so different from the class, right? In class, it's very formal and everything, but when you're in the lab, it's a different kind of thing, and it's. I think that also, again, enriches the experience that the students have.
Especially with that exposure to the graduate students, too. Yeah. So they're just sort of like a few years ahead, and you can learn kind of what are they doing? How did they come to make these pathways and these decisions? And it just expands your kind of perspective.
And it's so important if you're... it's a good experience for anybody, but if you're going into a graduate program, like you said, I learned this when I applied to PhD programs in neuroscience. I didn't have enough research experience, so I had to go back and get some and reapply. And so I always encourage students to get started as early as possible to try to build that experience in case that's something that they want to do. And we also have I think you mentioned the 4+1 program, the MPH program.
Right.
And we have a lot of students that take advantage of that. Even students that are going to med school are still doing that program as well. We're working on trying to set up similar programs for PA school, because that's a very popular destination for our students, but we haven't had one set up yet.
Yeah, and we do. So other healthcare, like people who don't want to go quite into med school, going into like a nursing program, which I think has been an increasingly popular way to get into healthcare because it is in high demand. I think we will always see. We talk about careers that are AI proof, and I think there's just certain things that humans have to deliver and have their eyes on. At Penn State and at most programs, to get that nursing degree, you really have to come in day one with that to meet all the requirements. But Penn State also has this second degree nursing program where if you have a bachelor's degree in any field, that you can transition into this 18-month accelerated program. So for students who are kind of discovering what it is they want to do, which I think, not everybody knows at 18 when they go to college, like, I'm done, this is my career, and I'm going to plan for it. We do have these other pathways for those kind of later discoveries to say, so if you're just generally interested in the health and wellness space, going into the majors or even pre-majoring in a particular college that is of interest to you can be an exploration pathway. And then there are ways to kind of cycle back to add on that 5th year to get the master's or to get there, even if you didn't know that's where you were going when you first showed up.
I'm actually shocked sometimes with the number of students that I encounter who know exactly what they want to do.
Yeah.
Because when I was 18, I did not.
God bless.
And I constantly have to have this conversation with some students who I talk to who say they don't know what to do and they feel like they should. And I try to emphasize that you have time to figure this out, and they can take exploratory classes like gen eds that are in, healthcare related fields and see if it seems like something that catches their interest, or they can try some research, but they have time to figure these things out.
And I think that's really important because, especially in the research side, if you want to go on and go to graduate school and get a PhD, that's a huge commitment. And you really have to be dedicated.
You should be sure.
And I tell students who start out, undergrads working in the lab, I said, to do that kind of degree, you really have to love it. And you have to love it on a beautiful Saturday afternoon. Instead of going out with your friends, you're going to set up 2 experiments, and that's the difference. And some people realize very quickly that that's not what they wanted. It wasn't what they thought. And I think that's a really valid thing as well. Yeah. And you have that opportunity to try stuff out, like you said. Yeah.
I think it's another thing that I tell students is that no opportunity that you take advantage of is a wasted opportunity, because if you don't like it, then you learned that this is something that's not for me. And I think that's one of the reasons why research experience is so emphasized for somebody going to grad school, because, research can be very different from what people think of when they think of research. So there's very tedious aspects of it. And so it's important to have gotten a taste of it to make sure that before you apply to a PhD program or even a master's program, I'm ready to do this for the next couple of years or 4 years or however long it might be. So.
Yeah, I think that's true. Students can easily come to college with an idea or goal that they are certain that they want, and then find out that it really isn't what they wanted, and that they're really going for this objective that we've certainly had students, come into the major later because of that, because, they were in education and realized, I don't like teaching, but that's okay. And I think that you're exactly right. That is something to embrace, even though it feels like a setback. It is actually saving you a lot of heartache in the future. And there are a lot of different ways you can redirect.
I always find that my advisees come to me and they're apologizing that they've decided to change majors. And I say, no, that's not, you don't need to apologize. You're finding your path, and you need to find the best thing for you. Right. Yeah.
Yeah, absolutely.
You could be a drastically different person between 18 and 22, and between 22 and 30. So I always encourage students as well to. And
I think that's the idea of college, and I think that's what Penn State strives to do, is put these experiences in front of you that you didn't even know existed. And so you should change. You should be evolving. Your interests should be expanding and can take a right turn or a left turn based on what new opportunities you take advantage of. So I think having those pathways and knowing that there's a way to get where you're going, and that there's support for that, even if you didn't show up on day one.
And sometimes the changes aren't aren't drastic.
They're-
You know,
yeah.
like I have students like the global health minor comes to mind again because I had a student that sticks in my mind who did that global health minor, and she wanted to go to PA school, and she did the global health minor. I think she did her field work in Tanzania, and it was just transformative for her. You know, she saw a different society than she'd ever been exposed to, and she came back and she still wanted to go to PA school, but she was intent now on incorporating some aspect of global health into what she was going to do as a career. So sometimes it's not these drastic deviations, but it's just incorporating or widening to involve more things.
Mm-hmm.
Absolutely.
Yeah. So, I mean, another thing, a lot of students get stuck on, you know, feeling like they have to go a certain path in terms of career, but also in terms of, you know, the campus that they're attending. And we get a lot of students in BBH who don't start out at University Park, who start out at other Commonwealth campuses and then move to University Park. We have a lot of World Campus students. We have our whole majors online. And these students get to so we have students that are coming from Commonwealth campuses that are doing research at Penn State, but also students that are at Commonwealth campuses that are doing research with professors that are at Penn State. And we have students on the World Campus who are doing research too. So, I mean, the new, not new, but our ability to stay connected and to communicate virtually has really opened up a lot of doors for students at other campuses to be able to have similar experiences to the experiences students at UP are having.
Yeah, I would say the same for HDFS. We have a very robust World Campus program. Our whole degree is also online, but also have really great leadership in our undergraduate program that integrates across all the campuses that host the major. So we have annual meetings where we bring all the faculty from HDFS across the Commonwealth come locally, so that all of our planning, all of our coordination and development of courses is really cohesive in some way. And so if there are particular campuses where maybe a course doesn't have enough enrollment to go, that's where the World Campus can really fill in and help make sure students are getting all the things they need to get a head start before they come to UP, if they want to come to UP. But there's also this integration where all the faculty know each other and can coordinate. I feel like we communicate with our Commonwealth campus colleagues very regularly. And so that is an integrated part of the opportunity, either to stay at another campus or to come to UP after 2 years.
Our programs are a little less integrated, but in a sense, for students that start out at Commonwealth campuses, it's quite easy for them to transition into our majors because most of the first year and a half is more basic foundational science and math. And so that's easy for them to do those at the Commonwealth campuses and then move into our majors. So we welcome students all the time that do that, but we don't really, like immunology is only offered at Altoona, and that's the only other place it's offered. So we're still working on that a little bit more.
All right. Well, thanks to both of you for a great conversation today. I'll finish it up with we are
Penn State.